Pain during sex is a common problem. Many people experience it at some point in their lives. It can be uncomfortable to talk about, but it's important to remember that you're not alone. Pain during sex can have many causes. Sometimes it's a simple issue like needing more lubrication. Other times it can be a sign of a medical condition. Whatever the cause, there are solutions available. It's important to address pain during sex. Ignoring it can lead to problems in your relationship. It can also prevent you from enjoying intimacy. Don't be afraid to talk to your partner and a healthcare provider. Remember, you deserve to enjoy sex without pain. With the right information and support, you can overcome this challenge. Let's explore the causes of painful sex and discuss ways to find relief. Pain during sex can be your body's way of telling you something is wrong. It's essential to listen to these signals and seek help when needed. There are various physical causes of pain during sex. One common cause is vaginal dryness. This can happen due to hormonal changes, certain medications, or not being aroused enough. Another possible cause is vaginismus. This is a condition where the vaginal muscles involuntarily tighten, making penetration painful. Other physical causes include infections, injuries, and medical conditions. Infections like yeast infections or sexually transmitted infections can cause pain, itching, and discharge. Injuries from childbirth or accidents can also lead to pain during sex. Certain medical conditions like endometriosis, pelvic inflammatory disease, or vulvodynia can also cause pain during intercourse. It's crucial to consult a healthcare professional for proper diagnosis and treatment if you suspect any of these conditions. Infections, including sexually transmitted infections, are a common cause of painful sex. These infections can be bacterial, viral, or fungal in nature, and they often go unnoticed until symptoms become severe. These infections can cause inflammation, irritation, and discomfort in the genital area. The inflammation can lead to swelling and redness, making sexual activity painful and uncomfortable. It's important to address these infections promptly to prevent further complications. Early treatment can help reduce symptoms and prevent the infection from spreading to other parts of the body. Yeast infections are caused by an overgrowth of fungus in the vagina. This overgrowth can disrupt the natural balance of bacteria and yeast, leading to symptoms. They can cause itching, burning, and pain during sex. The discomfort can be severe, affecting daily activities and overall quality of life. Bacterial vaginosis is another common infection that can lead to a fishy odor and discomfort during intercourse. This condition occurs when there is an imbalance of good and bad bacteria in the vagina. Sexually transmitted infections like chlamydia, gonorrhea, and herpes can also cause pain during sex. These infections are often transmitted through unprotected sexual contact. These infections often have no symptoms in the early stages, making regular testing crucial. Regular screenings can help detect infections early, even before symptoms appear. If left untreated, sexually transmitted infections can lead to serious health problems. These can include chronic pain, infertility, and an increased risk of certain cancers. If you suspect you have an infection or sexually transmitted infection, it's essential to see a healthcare provider for testing and treatment. Early intervention can make a significant difference in outcomes. Early diagnosis and treatment can help prevent long-term complications and alleviate pain during sex. Taking proactive steps towards your sexual health can lead to a more comfortable and fulfilling life. Injuries and certain medical conditions can also contribute to painful sex. These conditions may require specialized treatment and management to alleviate discomfort and improve sexual experiences. Injuries during childbirth, such as tears or episiotomies, can cause pain and scarring that may affect sexual intercourse. Pelvic floor dysfunction, which affects the muscles supporting the pelvic organs, can also lead to pain during sex. Medical conditions like endometriosis, where uterine-like tissue grows outside the uterus, can cause pain during sex, as well as painful periods and other symptoms. Pelvic inflammatory disease, an infection of the reproductive organs, can also lead to pain during intercourse and other complications. If you experience persistent pain during sex, it's crucial to consult a healthcare provider. They can perform a physical exam, order tests, and provide a proper diagnosis. Early diagnosis and treatment can improve your chances of finding relief and managing your condition effectively. Section 5. Psychological factors, the mind-body connection. While physical factors often play a role in painful sex, psychological factors can also contribute significantly. The mind and body are interconnected, and emotional well-being is crucial for a fulfilling sex life. Anxiety and stress can manifest physically, leading to muscle tension, vaginal dryness, and difficulty becoming aroused. Relationship problems such as communication issues or a lack of trust can also contribute to pain and discomfort during sex. Past sexual trauma or abuse can have a profound impact on sexual experiences. It can trigger flashbacks, anxiety, and fear, making intimacy challenging. Negative body image or low self-esteem can also affect sexual desire and comfort. Addressing psychological factors is essential for overcoming painful sex. Therapy, counseling, and relaxation techniques can help manage anxiety, improve communication, and address past traumas. Remember, seeking help for your mental health is a sign of strength and self-care. Section 6. The power of communication. Talking to your partner. Open and honest communication with your partner is crucial when dealing with painful sex. It's not just about sharing your discomfort, but also about understanding each other's feelings and finding a mutual path forward. It can be an uncomfortable topic to discuss, but it's essential for finding solutions together and maintaining a healthy relationship. Avoiding the conversation can lead to misunderstandings and emotional distance. Choose a safe and private space where you both feel comfortable talking. This setting can help ease the tension and make the conversation flow more naturally. Start by expressing your love and care for your partner. Reassure them that your goal is to improve your relationship and intimacy. Explain that you're experiencing pain during sex and want to find ways to make intimacy enjoyable for both of you. Be specific about what you're feeling and when it happens. Listen to your partner's perspective without judgment. They may have their own feelings and concerns that need to be addressed. They may have their own concerns or suggestions. Collaborate on finding solutions that work for both of you. Remember that you're a team, and working together is essential. Approach the issue as partners, not adversaries. Be patient and understanding, as it may take time to find solutions. Healing and improvement are processes that require time and effort from both sides. Communication is key to building trust and intimacy. The more you talk openly, the stronger your bond will become. By talking openly and honestly, you can address the issue together and find ways to improve your sexual experiences. This will not only enhance your physical connection but also deepen your emotional intimacy. Section 7. Practical tips for a more comfortable experience. While addressing underlying medical or psychological issues is crucial, several practical tips can help alleviate pain during sex and make intimacy more enjoyable. Lubrication is essential for comfortable sex, especially if dryness is a concern. Use a water-based or silicone-based lubricant to reduce friction and discomfort. Experiment with different positions to find those that put less pressure on sensitive areas. Foreplay is crucial for arousal and natural lubrication. Take your time, explore each other's bodies, and communicate what feels good. Don't rush into penetration and ensure you're both fully aroused. If you experience pain during penetration, stop and try again later. Forcing penetration can worsen pain and create negative associations with sex. Remember, intimacy should be enjoyable, not painful. Section 8. Seeking professional help. Don't suffer in silence. If you're experiencing persistent pain during sex, don't hesitate to seek professional help. It's important to understand that you are not alone, and many people face similar issues. A healthcare provider can help determine the cause of your pain and recommend appropriate treatment options. They have the expertise to guide you through this process and ensure you receive the care you need. Start by talking to your primary care physician or a gynecologist. These professionals are trained to handle such concerns and can provide a safe space for you to discuss your symptoms openly. They can perform a physical exam, order tests, and rule out any underlying medical conditions. This thorough approach ensures that all potential causes are considered and addressed. If necessary, they can refer you to a specialist such as a pelvic floor therapist or a sex therapist. These specialists have specific training to help you manage and overcome your pain. A pelvic floor therapist can teach you exercises to strengthen your pelvic floor muscles, which can help reduce pain during sex. These exercises are tailored to your specific needs and can make a significant difference. A sex therapist can help you address psychological factors that may be contributing to your pain, such as anxiety, past trauma, or relationship issues. They provide a supportive environment to explore these aspects and find solutions. Remember, you don't have to suffer in silence. Speaking up about your pain is the first step towards finding relief and improving your quality of life. Seeking professional help is a sign of strength and self-care. It shows that you are taking control of your health and well-being. With the right support, you can overcome painful sex and enjoy a fulfilling and pleasurable sex life. Don't let pain hold you back from experiencing intimacy and joy. Section 9. Conclusion: reclaiming your intimacy and pleasure. Pain during sex is a common problem, but it's not something you have to live with. By understanding the causes, seeking professional help, and communicating openly with your partner, you can overcome this challenge and reclaim your intimacy and pleasure. Remember that you deserve to enjoy sex without pain. Don't be afraid to advocate for your needs and seek the support you deserve. With the right information and care, you can experience fulfilling and pleasurable intimacy. Subscribe now for more updates daily which will change your life. Make sure you share your thoughts or ideas about this topic in the comments section.